Prioritizing healthcare, especially primary healthcare, is key to achieve optimal healthcare delivery all over the world. The federal government recently launched a primary healthcare leadership fund to boost this form of healthcare delivery systems in the country. Today, we are taking a look at how to improve primary healthcare system in Nigeria. Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Modupe. The conversation begins after this break. Please stay tuned.
Following the endorsement of the Seattle Declaration by the 36 governors of Nigeria in November 2019, the Nigerian Governors Forum, representing the 36 states of the Federation, hereby affirm our commitment to strengthen the primary healthcare system in the country. We therefore adopt and confirm our commitment in line with the Seattle Declaration.
Again, you have approved this concept. You have also charged the secretariats to pull together. You've mobilized your commissioners for health, your executive secretaries to come up with a performance framework for the leadership challenge. And today, we're here to launch the Leadership Challenge Fund after all of the amazing work that you have done. There has never been a doubt about the commitment of governors to the health of their people. But how do we maximize all of the ideas, all of the efforts that you continue to elaborate in your states?
This, may I add, represents your compact with your people to institutionalize regular engagement with relevant primary healthcare stakeholders and the primary healthcare functions themselves, to improve budgetary allocation and release for integrated one-stop primary healthcare through optimizing, and if you do nothing else, optimizing the human resources to deliver that primary healthcare system.
It is still Sound Health on Lagos Television. Joining us via Zoom this evening is Ayo Adebusoye, Chairman of Public Health Sustainable Advocacy Initiative, and he's going to share his expertise on how to improve primary health care system in Nigeria. Welcome to the program, Ayo.
Good evening, viewers. It's a pleasure to be here as always. Thank you.
All right, before we look into the new initiative recently launched by the federal government, let's take a look at the primary healthcare delivery system in Nigeria. If you're to review it, let's look at it. How far have we fared in terms of performance?
You can see the indicators showing a dismal, outlook. We have a very long way to go. We're one of the highest with regard to maternal mortality rate in the whole world, 556, at least in the southwest, to every 100,000 inhabitants for maternal mortality. Neonatal mortality rate also high, 35 deaths for every 1,000 live births. Infant mortality rate, 47 for every 1,000 live births. So, under 5 mortality rate, 59 out of every 1,000. So, these show our position that because these are all things that should be taken care of by the primary health care. mother and child issues, mother and child health. And these are clear indicators of our level. We have first or second case mortality rate in these areas. And I think one of the things we really need to address is how much priority are we as leaders, citizens putting on health. When things like this come up, you begin to think that, it's like we're thinking, when COVID came up, we saw the importance of health, that everything stopped. We health had to go on. And this shows exactly the prime importance of health in the polity. And the World Bank has shown that until governments now invest in health first, that will catalyze economic development. So it's like they're going to get economic development first. Your health system must be in place because a healthy workforce that can generate wealth. So our primary healthcare system now, from those indicators, objectively show that there's a huge need for 4 months a day. A state of emergency should be declared. About health generally, including primary health, we know what's happening with regards to the brain drain. All our health workers just heard how, they say nurses, the MD there said about 4 nurses resigning every day. So where does that leave the primary healthcare system? When does that the backbone of the primary healthcare? So I think it's something that we all know it has issues, huge challenges right now that have to be addressed.
All right, to change the narrative, the federal government recently launched the Leadership Challenge Fund. Tell us, what does this initiative, what is it all about?
Well, when we say the federal government, once again, these are development partners, donor-funded initiatives. Even though, yes, they have to get their commitments by the state governments, the governors forum, in its commitments to improve the private healthcare system. Bill and Melinda Foundation are involved, UNICEF are involved, Dangote Foundation are involved. And you see, my challenge, some of us have this challenge with such initiatives when we have to wait for external partners, donors, to push something as fundamental as health. So now all the state governments have made commitments that they're going to improve funding for private healthcare, they're going to improve their releases, they're going to also try, and because this is very critical, to ensure that the local governments also have their own leadership challenge. So what will happen is that there's supposed to be indicators with regards to improvement in private healthcare. And then that will be linked to various awards. They're going to give awards to the 12 best overall performing governors and one overall performing, so there will be 13 awards. But the challenge is, so far we haven't yet got the amount that's going to be awarded. And this is where the whole issue of health budgeting is come with transparency, accountability, so that people can track objectively what is going on. So once the governors commit to various indicators and improve, then they'll be given certain awards along the way to encourage them. The challenge, of course, is that so far, many of them are not doing what's going to change. This is the carrot that is being used sometimes, many times, to encourage governments to do what they should actually normally do. So they're supposed to be doing this basic, ensuring that budgets are allocated for private healthcare, ensure that they are released, because one thing is to have allocation, the other thing is to even have the funds released. So for us, we are also concerned that even now we still don't yet know even how much are these awards. Everything should be clear and open, so that the whole process can be monitored and tracked by objective, independent citizens who actually are supposed to be the beneficiaries. It's a good initiative in the sense that anything that can, push the needle a bit is good. But unfortunately, it's such a challenge. Also in Lagos State, our out-of-pocket expenditure, health, and I said about 87%. That means out of every naira spent on health, it's 7 is from out-of-pocket expenses. Still, health insurance is still very low. And we know, of course, now with the new National Health Insurance Authority Act, health insurance is mandatory for all residents of Nigeria. So this is one area that can push the needle with regards to even access to primary health care and even actual funding of primary health care. Because one thing is to even have the insurance, the demand for it. Another thing is for the supply. What are the state of our private health care facilities? So that's where the funding of it has to come in. And we should not forget that the local government constitutionally actually are mandated to actually fund and establish private health care in their local government. So one discussion that has to happen for this leadership fund to succeed is the local government chairman and the primary health care authorities in the states have to come together to actually ensure that this primary health care under one roof, which is actually where they're going with this, can actually take effect. I had a discussion 2 days ago with the chairman of the Bariga LCDA, very cerebral, visionary local government chairman, Rigo Olabi, and he explained how he had developed one state-of-the-art primary health care center, which was in commissioned by Mr. Governor a few years ago. But now, to maintain and have too many things, X-ray machine, ECG machine, different things, incubator. But now to get it for the maintenance part is now an issue because of the public servants there are not pulling their weight. Things are not working as they should be, even though he had that vision. So there has to be that collaborative effort by all hands. The private healthcare board and the local government health authorities should start to function as they are meant to be according to law. We have local government health authorities in place. They've been sworn in, but how functional are they? Because they're the ones who can bring in the expertise from the community, the local government, and ensure that each facility is fully supported. And those are the things which should be taken care of by the Challenge Leadership Fund if they want it to succeed. The local government health authorities must be empowered to do the work that they've done. So far, it's just paper. This is something we want to see going forward.
All right, that brings me to my next question. This initiative is to bring the primary health care under one roof. Won't this step be too cumbersome? Are we not expected to be looking at autonomy now?
Yeah, in fact, frankly, when we say autonomy, there are so many challenges with that phrase. It sounds nice, but at a point in Nigeria, we have to decide what are we? We're federating units of 36 states and the FCT. We're not a federation of local governments. So the states ultimately are responsible for creating the local governments. It's simple as that. The federating unit of Nigeria are the states. So there is still that role for the states. The local governments, once they are established, yes, there must be some, well, if you like to call it autonomy in their work, but it has to be done in collaboration, in a regulated fashion with the state authority. And one of the things which was breaking that up is the LGHA. Local government health authorities are supposed to be like appendages linked to the state primary healthcare board. They are the ones supposed to be like the primary healthcare board at the local government level. And they can raise funds. They can get funds in their own right. If they can actually employ people to a certain level, so that collaboration is something that is needed to make primary healthcare under one roof work. So they really need to get together with the local government chairman, with the LGHAs, and the private healthcare board together to see how this can work. Because right now it's still not really clear. I mean, we've had issues in the past where even just to put in a brain box to fix an ambulance at a primary healthcare center, the medical officer in charge has to write to the chairman, get approval, he couldn't get it. Even the security guard does not take instructions from the
medical officer
of the health facility. So it's all on my doing. And of course, the medical officer of health, many times they are linked more with the primary healthcare board. So it's all very hazy, the governance structure. So once it's not great, then it's very difficult to deliver effective health services, and this is what we are getting now, that the health outcomes are not there. Everybody has to come together, including the community. The community have a role to play. The World Health Committees are very critical. They should not just be political appointees, people who just want to give some little position, but we need people who are passionate about health, and we do have some like that. We have situations where some dynamic World Health Committees have even supported private healthcare facilities, have even provided accommodation for some give resources, consumables to ensure that those facilities work. So this is one area that has to be looked into, how we're going to bring in the LGHs, the World Health Committees, to make the system, the health facilities, and the private health centers work effectively across the state.
Is there a difference between the basic healthcare provision fund and this present initiative by the federal government?
Yes, the basic healthcare provision fund is that 1% consolidated revenue fund, which should be going through the NPCDA, the National Private Healthcare Development Agency, and the National Health Insurance Authority to the state governments. And of course, there's a small part for emergencies as well. So that is different. This one is a completely, because it's development partners who are putting this one together to support private healthcare completely. There will be some linkages, because part of what the PSC Leadership Challenge Fund will do is also be able to ensure that the basic healthcare provision fund is actually being utilized effectively, etc. But they are completely different from this one. The basic healthcare provision fund is coming directly from the Sierra Consolidated Revenue Fund, and this one is mainly made up of development partners.
All right, this initiative is laudable, no doubt about that. But how do we sustain it?
Yes. So one of the things, again, as a country, we have to begin to face is that we must take the bull by the horns. We must take responsibility for our health care system. We cannot have a situation where we're depending on external parties for our malaria. If there are no foreign partners, our HIV interventions are completely collapsed. That is not the situation of sustainability. We must accept the responsibility for our health system. Devise means by which we can raise this fund. There was supposed to be 1 cup per second, we keep on talking about it, 1 cup per second tax in the new National Health Insurance Authority Act. But it was removed. At last moment, it was in the draft, but it was removed. Those are the kind of things that are needed. We need that kind of funding that can come in to be able to support the health sector, because health sector is funding, and they say it's not a public good because it's something which depletes. You need funds to do it, to make sure it happens. There's no free health anywhere. Somebody must pay. Even in climes that you see, UK, the health system they have there, it's taxpayer money. And one of the challenges we have in Nigeria, which we need to come to grips with, is Nigeria has, if not the lowest GDP to tax ratio. That means we have a very, very low number of people who are paying tax. So how are we going to fund it? So we have to think of innovative means of getting money. And one of those means would have been this 1 cup per second. But we see the Ministry of Finance got a 5% limit now, which I think is why they stopped that. We need to have innovative means. And in Lagos State, where we have the biggest concentration of corporate bodies, etc., this is one area we really need to see how we can devise and get the funding to let it work. Without the funding, we cannot, health system will just keep on being where it is. The doctors, nurses have to be paid very well. They have to be decoupled from the civil service structure. They should be able to be paid by the hour, like other clients. Be able to work in different places. So we have a lot of expertise. We have a lot of those who are retired, health workers, nurses, doctors who are retired and are not being engaged. It means we have to start to get innovative ways to get it. Because health system is the people, the personnel, and the equipment. Those are not just the buildings. Many times we like to build buildings. Buildings are not needed. It is the people, the doctors, the nurses, the health workers, and the equipment that make up the health system. And that needs funding. And the funding is out there. Because already it's 7%, like in Lagos, it's out of pocket expenses, but it's all out there. It needs to be brought in, harnessed, so that it will not be a financial burden to the citizen, the patient who is coming in. We have so many cases. I have one case now. Somebody is stuck in the hospital, I don't know, maternity, cesarean section. He's practically doesn't know how much he's doing, and they ask him for 500,000. How are they going to pay? Because they are not insured. And there are many, many cases like that. So what do we do to get this system working? It's funding. And all hands to be on deck to ensure that our health fund, there's a Lagos State Health Fund, can become viable so that we can actually start being able to have those resources. We need a large pool of funds to make health work, deliver maximum health for our people. It's not going to happen otherwise. It's not free. And I think we need to get that happen. Somebody must pay something, right?
Hopefully, the key players, especially national primary healthcare development agencies, will rise up to the task and ensure primary healthcare delivery is no longer the same in the country. Ayo Adebusoye, thank you so much for your time and expertise. We really appreciate you.
Thank you.
All right,
Thank you very much. Pleasure as well.
You're welcome. I have been speaking with Ayo Adebusoye, Chairman, Public Health Sustainable Advocacy Initiative on how to improve primary healthcare delivery systems in the country. Sound Health continues with Trending Health Report. Please stay tuned. All right, this is where we say thank you on today's episode of Sound Health. Primary health care centers are the basis of any healthcare delivery in any country. Ensure these centers are fully optimized to meet the needs of the people at the grassroots. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social #SoundHealth. A sound health is a sound mind. Make healthy living your choice.